Now, I want to take you to Peru because, meantime, coronavirus cases are also rising in neighboring Peru. The health ministry there says the number of cases has jumped to nearly 124,000 with nearly 3,700 deaths. Peru was one of the first countries to close its borders and put lockdown measures in place. Now there is concern the country has spiraled into a health catastrophe. Our Rafael Romo is covering the story from Atlanta for us and joins us now. So, Rafael, explain to us how we got here, because the president closed borders early, lockdown measures were put in place, testing was also taking place. So what went wrong?
Yeah, that's a very good point, Isa. It was one of the first countries in Latin America to essentially go on lockdown. The government mandated, you mentioned some of them, stay-at-home orders. There were curfews, border closings, and yet the number of confirmed cases in the country of 32 million is well above 120,000. Health experts say inequality has forced the poor to venture outside their homes for work, for food, even banking transactions. And Isa, they crowded supermarkets and banks, increasing the risk of transmission. Field hospitals have become a necessity, and inside public clinics, the situation has turned chaotic. This video obtained by CNN shows a government medical center in Lima, Peru's capital, with dozens of patients waiting for care in wheelchairs because there are no beds available. The leader of Peru's main medical association describes the coronavirus pandemic in the South American country as a health catastrophe. Peru's health system, Dr. Alfredo Celi says, is already overwhelmed by the pandemic. The country of 32 million on South America's Pacific coast has a coronavirus mortality rate of around 10 per 100,000 people. It's just as bad as Brazil, its much larger neighbor to the east, with nearly 7 times Peru's population and the world's second highest number of COVID-19 cases. The health system is so overwhelmed that doctors say they must make hard decisions. Since there aren't enough beds available, some say critical health care is prioritized for those with better survival chances.
Nosotros no hacemos discriminación de edad.
Dr. Jesus Valverde, president of Peru's Intensive Care Medical Association, says it's not about discriminating against the elderly, but he admits there's a point system based on each patient's outlook.
No se equivoquen.
President Martín Vizcarra has stayed away from the controversy, choosing instead to take action, including forming a COVID-19 task force.
No es parte de las estrategias de nuestro Ministerio de Salud.
Pilar Macetti, the task force's chief and a former health minister, says it's neither the health ministry nor the task force's policy to dictate whether patients get access to medical care based on their age. Macetti also says prioritizing healthcare based on the patient's outlook is not yet happening, although she doesn't rule out it may be necessary in the future. Those on the front lines have no time for disagreements. Teams of nurses and doctors are traveling to the hardest hit areas. Along with Lima, the capital, the jungle region and the north have become Peru's new COVID-19 epicenter. It's a dangerous mission. According to Peru's Medical Association, more than 30 doctors have died so far fighting the virus. Health professionals, the group is now paying homage at its headquarters in Lima. And President Martín Vizcarra has extended the state of emergency until June 30th. Isa, Peru has the second highest number of confirmed COVID-19 cases in Latin America, behind the country you were just talking about before with Shasta Darlington, Brazil. But we have to mention that Brazil has 7 times the population of Peru. Now back to you.
Thank you very much, Rafael, for putting into perspective there. Rafael Romo.